Welcome back to Valley Life. Standing here in one of the great rooms here in Horine Chiropractic, I'm getting the chance to get a little deeper into Dr. Horine's management of pain and finding out, do you have peripheral neuropathy? And then if you do, how do we go about making that happen? Doc, how are you?
Real good, Rich.
Good. So let's get back into peripheral neuropathy. Do you have it or not? What's the assessment practice? And then once that happens, how do you go about with the management?
Well, yeah, the first step is actually determining if the patient has peripheral neuropathy. Okay. And so we go through a neurological evaluation as well as a musculoskeletal to rule out other things like spinal stenosis, for example, can cause similar type symptoms. Once we've established that the patient does have peripheral neuropathy, I need to determine how far along it is, what type of damage has occurred, because there's several types. There's large fiber neuropathy, which causes numbness and inability to feel your feet. There's small fiber neuropathy, which typically won't show up in a lot of neurological evaluations, and it causes pain, but the nerve conduction studies typically done by neurologists typically won't show that up. Okay. So we have to really make sure we know what we're dealing with and what type of neuropathy we're dealing with. And then if they're a candidate from our program, then we can start them on a management program. And that entails basically a three-part approach. One is to rehabilitate the damaged nerves as much as is possible. Two is to improve the nerve-brain communication. And then three is to work with any metabolic issues that are typically triggering or causing this condition to occur. So it's fairly comprehensive as far as the approach.
Well, Doc, that approach I think that you're taking to attack everything from all angles and doing it aggressively, which you spoke about before, that helps with the management, and it's not just a temporary fix. When you kind of hit all three, now you're looking at long-term care to help people so that they're back to normal and stay there.
Right. That's what we're after, is long-term results. And we do that, again, by working with us in a very comprehensive, multi-layered approach.
Sure. And you talked about being aggressive on this. It's by hitting three fronts, then hopefully you're able then to manage this a lot quicker.
Correct. We first look at working at rehabilitating the damaged nerves as much as is possible. And with that, we use different therapy modalities such as transcutaneous electrostimulation at a 7.83 hertz, which is very effective typically for neuropathies. And that works more of a local area to improve the damaged nerves, let's say in the feet or the hands. Then we also use modulated electromagnetic field therapy for the full body to help the nerves heal and regenerate globally, because as we mentioned before, neuropathy is not just about the feet and hands, although that's what brings a patient into my office. Right. And they don't realize that a lot of the symptoms that they have, like fatigue or stomach issues, bladder issues, they have no idea that that may be coming from the same thing that's causing their neuropathy. The neuropathy in their feet is kind of like the canary in the coal mine. It's giving signals that there's something going on with the peripheral nervous system that's not good.
Right. And once you start then managing everything from that approach, it's amazing how things just kind of, for a lot of people, and we'll actually go back to some testimonials about how things, it's just like the fog has been lifted and they realize, maybe I better, hit this from all angles.
Right. And exactly. And then we also work with metabolically, because a lot of these conditions can be from dysglycemia or blood sugar problems. It could be from thyroid dysfunction. It could be from vitamin deficiencies. Food sensitivity, surprisingly, are a big one. And so we have to rule those out, because often there's certain food sensitivities that are highly associated with neuropathy and the patient has no idea.
Right. And let's not just take my word for it. I want you to listen to a testimonial right here from a great patient.
Not only is my foot pain so much better, I mean, I'm just so grateful for that, but my lifestyle has also improved. They have given me the education to just provide me with a healthier lifestyle all around.
What have you got to lose? I mean, you're losing all the feeling in your feet. It's getting higher. It's in the ankles. Is it going to go higher? What have you got to lose when you can have another life? And he was just so willing to try anything and everything, and was so happy with any response. And I would come in and say, I'm ready to get jump started. And it was just truly wonderful.
So if you'd like to know some more information about peripheral neuropathy, please give Dr. Horine's office a call. They've got a free information pack they'd be happy to give you and love to speak to you about it. It is something that I can't wait to dive even deeper into, and I think you should as well. Don't go anywhere. There's more Valley Life coming up right after this.